Welcome to our comprehensive guide on recognizing and managing a wide range of hair types, hair conditions, and hair loss. In this lesson, you'll gain the confidence to evaluate hair and scalp health, identify common issues, and recommend effective treatments. Whether you're a budding barber or simply passionate about hair care, understanding these fundamentals will empower you to support every client's unique needs. Let's begin by exploring what special care your hair might require to stay healthy, and how building your knowledge can inspire confidence in your professional journey. By the end of this lesson, you'll be able to confidently identify the steps involved in conducting a thorough hair evaluation before any barbering service. You'll also be equipped to describe the most common hair and scalp conditions encountered in the barbershop, and offer practical examples of various hair loss conditions along with available treatments. This foundational knowledge sets the stage for delivering exceptional client care and building lasting trust. Each person you work with brings a unique set of hair characteristics and needs. No two heads of hair are exactly alike, which is why it's essential to evaluate every client's hair individually. This personalized approach ensures that you can tailor your services and recommendations, leading to better results and higher client satisfaction. Let's look at how to start this evaluation process. Before providing any service, it's important to become familiar with your client's hair. Start by determining their hair type and density. Hair texture can range from coarse, which feels like wool and may need stronger products, to medium, which feels like cotton and processes normally, to fine, which feels like silk and is more fragile. Recognizing these differences helps you select the right products and techniques for each individual. A visual examination is your first step in assessing the condition of a client's hair. By closely observing the hair, you can gather clues about its health and determine which products or treatments will be most effective. Don't hesitate to ask your client questions about their hair care routine and any concerns they may have. This open dialogue helps you make informed decisions and builds trust. Hair density refers to the number of hair follicles per square inch on the scalp. There are three main categories: light or thin, medium, and heavy or thick. Understanding a client's hair density is crucial for recommending appropriate styles and treatments. For example, thick hair may require different cutting techniques or products compared to thin hair. Always tailor your approach to the individual's density for the best results. Two important factors in hair condition are porosity and elasticity. Porosity is the hair's ability to absorb moisture, liquids, or chemicals, while elasticity is its ability to stretch and return to its original shape without breaking. Both factors influence how hair responds to treatments and styling. Assessing these characteristics helps you choose the right products and techniques for each client. Porosity can be categorized into four types: average, resistant, extreme, and uneven. Average porosity means the cuticle is slightly raised and absorbs moisture well. Resistant hair has a flat cuticle and absorbs the least moisture, often called poor porosity. Extreme porosity indicates the cuticle is raised, making hair very porous and often damaged by chemicals. Uneven porosity means there's a mix of types along the hair strand. Identifying porosity helps you plan treatments effectively. Elasticity is a measure of hair's strength and flexibility. Normal dry hair can stretch about 20% of its length, while wet hair can stretch up to 40–50%. Testing elasticity helps you determine if hair is healthy or structurally weak. Hair that returns to its original shape after stretching is in good condition, while hair that doesn't may need special care to prevent breakage. To test the structural strength of hair, remove a strand from the side of the head, hold it between your thumb and forefinger, and run your nail along its length. Pull the hair taut for 10 seconds, then release. If the hair returns to its original curl pattern, it's in good condition. If it only returns halfway or less, it's structurally weak and may require special care. The amount of moisture in the air directly affects the moisture content of hair. In humid regions, maintaining curl retention can be challenging, while in dry regions, hair may become flyaway and difficult to manage. Understanding the impact of climate helps you recommend the right products and routines for your clients, ensuring their hair stays healthy regardless of the environment. The hair strand is protected by 7–12 layers of cuticle scales, which should lie flat along the cortex. The acid mantle lubricates the outermost layer, reducing friction. However, frequent combing and brushing can damage the cuticle, making hair more vulnerable to breakage and environmental stress. Proper handling and care are essential for maintaining cuticle health. Several common hair conditions can affect clients. Broken hair, also known as abraded hair, features a cracked and frayed cuticle. Split ends or brittle hair show small cracks that deepen into the cortex. Nodules or knotted hair appear as lumps along the strand. Candidese refers to grayness or whiteness of scalp hair, which can be congenital or acquired. Recognizing these conditions is key to recommending the right care. Other hair conditions include monothrix or beaded hair, which breaks between beads or nodes. matting where hair strands tangle together, ringed hair showing alternating bands of gray and dark, hypertrichosis, which is abnormal hair coverage, and hirsutism or excessive terminal hair in women. Each condition requires a specific approach for management and care. Mechanical damage often results from improper use of cutting and styling tools. For example, excessive heat or tension can melt or break the hair cortex, leading to weakened strands and increased breakage. Understanding the structure of normal versus damaged hair helps you educate clients on the importance of proper tool use and gentle handling. A careful scalp analysis is essential before any hair service. By examining the scalp, you can identify potential disorders or diseases that may affect the outcome of treatments. Early detection allows you to refer clients to a physician when necessary and ensures their safety and well-being. Common scalp disorders include scales psoriasis, which appear as thick, crusty patches of red, irritated scalp, and dandruff pityriasis, which is chronic and causes excessive flacking and itchiness. Dry dandruff presents as translucent flakes, while greasy or waxy dandruff involves oily flakes that stick to the scalp. The main cause of dandruff is the fungus Malassezia. Frequent shampooing with anti-dandruff products is recommended. Ringworm tinea is a contagious scalp disease caused by a vegetable parasite, appearing as red, circular patches with blisters. Variants include ringworm of the beard and scalp and honeycomb ringworm, which causes dry, yellow, encrusted areas. Other infestations include itch mite scabies and lice pediculosis capitis, both requiring medical referral. Early identification and referral are crucial for client health. Barber's itch or folliculitis barbae is an infection of the face and neck, causing redness and pustules around hair follicles. Psychosis barbae is a chronic inflammatory infection of the beard and mustache area, leading to pain, itching, and burning. Razor bumps or pseudofolliculitis barbae are usually caused by ingrown hairs and result in chronic inflammation. Proper hygiene and technique can help prevent these conditions. As a barber, you're often the first to address client concerns about hair loss. Understanding the causes and types of hair loss allows you to provide reassurance and recommend appropriate actions. Hair loss can impact a client's confidence and well-being, so your knowledge and empathy are essential in supporting them. There are three main types of hair: lanugo, vellus, and terminal. Lanugo is the fine, silky hair present at birth, which is soon replaced by vellus hair, short, fine, and non-pigmented. Terminal hair is long, thick, and pigmented, found on the scalp and eyebrows. On average, people lose 40 to 100 hairs daily, which is considered normal. Alopecia refers to excessive hair loss, which can be caused by infections or inflammatory diseases and affects both men and women. The most common form is androgenetic alopecia, characterized by progressive shrinking of scalp follicles. This leads to male pattern baldness or thinning in females. Understanding the different forms of alopecia helps you guide clients towards suitable treatments. In men, androgenetic alopecia often results in a horseshoe-shaped fringe pattern, while in women, thinning is more generalized over the crown with the front hairline usually retained. Evaluating the pattern and density of hair loss is important for diagnosis and treatment planning. It's common for men to go bald, but rare for women to lose all their hair. To evaluate hair loss, consider both the pattern, shape, and location of the affected area and the density or how much hair remains. This assessment helps determine the best course of action, whether it's medical treatment, lifestyle changes, or cosmetic solutions. Accurate evaluation is the first step toward effective management. Beyond androgenetic alopecia, there are several other types: postpartum alopecia, temporary loss after pregnancy; alopecia areata, sudden patchy loss; alopecia totalis, total scalp loss; alopecia universalis, entire body loss; alopecia senalis, age-related; and alopecia syphilitica, linked to syphilis. Each type has unique causes and implications, requiring tailored advice and often medical referral. Alopecia prematura refers to early-onset baldness, while telogen effluvium is premature shedding during the resting phase. Traction or traumatic alopecia results from repeated stretching or pulling of hair, often due to tight hairstyles. Recognizing these causes helps you advise clients on prevention and care strategies. Treatment options for androgenetic alopecia include FDA-approved products that can regrow hair or prevent further loss, surgical procedures, wigs, hair additions, and cosmetic thickeners. Creating the ideal environment for hair regrowth or loss prevention is key. As a barber, you can guide clients toward the best solutions for their needs and preferences. It's important to regularly check your understanding of key concepts. Review questions about hair evaluation, common conditions, and treatments help reinforce your learning and ensure you're ready to apply your knowledge in real-world scenarios. Take a moment to reflect on what you've learned so far. Continue to test your understanding with additional questions and scenarios. This practice not only helps you retain information but also prepares you to handle a variety of client needs with confidence and professionalism. Remember, ongoing learning is key to mastery in hair care. Engage with practical questions to affirm your understanding of hair and scalp evaluation, common conditions, and treatment options. These exercises are designed to help you apply what you've learned and identify any areas that may need further review. Practice makes perfect. As you complete the knowledge check, take pride in your progress. Each question you answer correctly builds your confidence and prepares you for real-world client interactions. Keep challenging yourself to deepen your understanding and refine your skills. Congratulations on reaching this point in your hair care education. Take a moment to celebrate your achievements and reflect on the valuable skills you've gained. With this knowledge, you're well equipped to provide exceptional care and guidance to your clients, helping them achieve healthy, beautiful hair. As we wrap up, review the key concepts covered in this lesson. Reflect on how you can apply this knowledge in your daily practice, whether you're working in a barber shop or advising friends and family. Continuous learning and reflection are essential for growth and excellence in hair care. Now that you've built a strong foundation in hair and scalp evaluation, common conditions, and hair loss management, you're ready to continue your journey. Stay curious, keep learning, and always strive to provide the best possible care for every client. Your expertise makes a real difference in people's lives. Thank you for joining this lesson on mastering hair types, conditions, and loss. Your dedication to learning and improving your skills is commendable. Remember, every client is unique and your knowledge empowers you to make a positive impact. Wishing you success and fulfillment in your hair care journey.